Have you ever looked at a medical bill and just felt completely lost? Like you're trying to read some kind of ancient secret code? Yeah, you are definitely not alone. With billions of dollars flying around, that jumble of codes is more than just confusing. It's actually a high-stakes system designed to protect everyone. And today, we're going to crack that code.
So let's just jump right in with the big question, shall we? What is the real difference between a simple typo that costs a few bucks and an intentional scam that could literally land someone in prison? The answer, it turns out, is simpler and way more important than you might think.
And here it is. The whole thing boils down to one single critical word: intent. Was it a genuine accident, a slip of the keyboard, or was it a deliberate, calculated move to deceive someone? That one little distinction is the bright, shining line between an honest mistake and a serious crime. And it's the key to understanding this entire world. Okay, so let's put some official names to these ideas. In the world of healthcare compliance, this all comes down to two key terms: fraud and abuse. And knowing the difference between them, well, it's absolutely critical for everybody involved. The difference is pretty clear when you see it side by side. Fraud is intentional. It's knowing deception for some kind of gain. Basically, it's lying on purpose. Abuse, on the other hand, well, that's when billing practices are wrong, but they're unintentional. It's a mistake, for sure, but it can be a really, really costly one that adds up to tens of billions in waste every single year. Now, both can get you into a world of trouble with huge penalties, but only one is a premeditated crime.
All right, let's put this to the test. Imagine this: a provider bills for a super complex, long office visit, when really it was just a quick, simple checkup. They know they don't have the notes or documentation to back it up, but they do it anyway to get a bigger paycheck. So what is it? A, abuse, or B, fraud?
If you went with fraud, you are spot on. The key word, the one that changes everything, is knowingly. The second there's a conscious decision, an intent to deceive for money, it crosses right over that line from a simple mistake into full-blown fraud. See? It all comes back to intent.
Okay, so if fraud and abuse are the big problems, then what's the solution? Well, there's this entire framework built specifically to prevent these issues, and it's all wrapped up in a concept called compliance. To put it simply, compliance just means playing by the rules. It's the whole collection of legal, ethical, and professional standards that dictate how healthcare gets done, how it's documented, and how it's billed. You can think of it like a giant safety net that's there to protect patients, doctors, and really the entire system.
And these right here, these are the heavy hitters of compliance. You've probably heard of HIPAA, right? The one that protects your private health info. But there are others, like the False Claims Act, which goes after fraud against government programs like Medicare. And then you have the anti-kickback and Stark laws, which are there to stop things like bribes for referrals and other conflicts of interest. Altogether, these laws are the main pillars holding up that safety net.
Let's zoom in on HIPAA for just a second, because this one impacts every single one of us. Here's a quick scenario. Which of these is a total clear-cut violation? A doctor's office sharing your info with the billing department, or a nurse posting about a patient's diagnosis on their personal social media page? And the answer is B. No question about it. Any information that can identify a patient and is connected to their health, that's called Protected Health Information, or PHI, is extremely confidential. I mean, sharing it with the building staff is a necessary part of the job, but blasting it out on social media for the world to see, that is a massive breach of trust, and it's against the law. Okay, so we get the rules, we understand the stakes, but how does this whole system actually work on a day-to-day basis? I mean, how on earth do you accurately bill for millions of different services, supplies, and drugs? Well, you need a universal language. And that language is called HCPCS. That stands for the Healthcare Common Procedure Coding System. The easiest way to think about it is like a universal product catalog for absolutely everything in healthcare. It's this standardized system of codes for everything from an ambulance ride to a wheelchair to a specific injectable drug. And the whole system is organized really logically into these big categories. You've got your A codes, which cover things like medical supplies. E codes are for what's called durable medical equipment, like hospital beds. J codes are for drugs, and L codes cover things like braces or artificial limbs.
So with that in mind, let's try a quick pop quiz. If a hospital needs to bill an insurance company for a wheelchair, which of these code ranges are they going to use? Is it A, E, or J?
You got it. It's B, the E codes. And here's an easy way to remember it. E stands for equipment.
specifically durable medical equipment, which is exactly what a wheelchair is. Simple, right?
All right, we've talked about the why, the whole framework of compliance, and we've covered the how, that universal coding system. So now let's put it all together and see what this actually looks like on a real-world charge.
We're going to use a super common, really simple example. A patient breaks their leg, and the hospital gives them a standard pair of crutches to take home. So how does that simple act turn into a specific line item on a medical bill?
The specific code that would pop up is E0114-NU. Now I know, at first glance, it just looks like a random string of characters. But trust me, every single letter and every number in that code is there for a reason. It's telling a very specific story. Let's break it down. Okay, first up, the main code, E0114. Think of this as the specific part number. It's the universal ID for one thing and one thing only, a pair of standard crutches. But what about that -NU that's tacked onto the end? That's what's called a modifier, and that NU is absolutely critical. It tells the insurance company that these crutches are new equipment, not a rental or a used pair.
And that right there, that's the real beauty of this system. It's simple, it's incredibly precise, and it's universal. That code, E0114NU, means the exact same thing at a hospital in Florida as it does at a small clinic in Alaska. It makes sure that the doctor, the patient, and the insurance company are all speaking the exact same language. No confusion.
So after all that, why should you care about any of this? Because this entire complex system of compliance and coding, it was all designed to protect you. It protects your private health information, it makes sure you're billed fairly and correctly, and by having this transparent, rule-based system, it helps fight that massive, multi-billion-dollar problem of fraud and waste. It keeps the whole system that we all rely on honest and stable.
So, the next time a medical bill lands in your mailbox, I hope you see it a little bit differently. Not just as some confusing list of charges, but as a story, a really precise, detailed story about your care, told in a language that's designed from the ground up to be accurate, ethical, and fair. The only question is, now, are you ready to read it?